All right, hello everyone. Thank you for staying for the last panel with us ladies. Appreciate you being here. Today we're starting the conversation more completely around aftercare or continuum of care. My talk today is expanding the opportunity around Ibogaine through a continuum of care. My name is Deanne Adamson. I live in San Diego, California. I run a business called Being True to You Recovery Coaching. I started doing this about 7 years ago in 2010. My original training was in mental health counseling. I very quickly realized I didn't want to work from that approach as a psychotherapist because of all the psychiatric medications that were being handed out, and working in managed care wasn't my best impression stepping into things. So I ended up starting a coaching business, and I met the Ibogaine community very quickly. And I've been working with Ibogaine clinics now for 6-7 years, talking to the patients before and afterward. We've probably talked to upwards of, I don't know, close to 2,000 people between me and the team, and it's been quite an experience. So today I will share my observations and some impressions that I have around the medicine. I have taken Ibogaine myself, blood dose. I've done a lot of microdosing, and I have a history of addictions like anyone else, I think. And so I've got personal and professional experience on the subject matter. So let's start with some observations. As far as observations go, what I have seen over these years is that Ibogaine works. Ibogaine seems to always work. It always does its job in helping people through the physical dependency, the withdrawals, of course the cravings as well, the physical and mental cravings. Seems like physical almost always, and mental cravings often as well are drastically reduced, if not eliminated, for a period of time. And Ibogaine also does its job in helping a person open up their psychology so they can take a review of their life and their psychology and maybe where they went wrong or where things went wrong and their relationship to their true self. And I see that Ibogaine opens a great opportunity for people to create lasting change in their life. And it's also a medicine that just keeps on giving. So it's not an experience that just lasts a night or a week, but lasts several weeks, several months, and sometimes people report years later that it's still serving them. But what I also see is that people are not showing up to do their work. So the medicine is doing its work, but a lot of times the patients or clients don't understand the medicine, the nature of the medicine, how it works, and so I feel that many people, if not most, are really missing the great opportunity that Ibogaine or Iboga has to offer because they don't understand what their role is in working in partnership with the medicine and transformational work in general. I think what I see is that people are approaching the medicine with the same addictive thinking that they're approaching their life. And sometimes I notice this in us as professionals as well, in that there's an external cure for an internal problem. And although there are external medicines and techniques and practices that can really help us, it's an internal process to evolve through our suffering and through our addictions. And I see that Ibogaine is teaching us this and showing us this, but a lot of times people don't realize this until after the fact, until after they've relapsed again. And for many people, they're saving every penny they have to get to this experience, and they don't have another opportunity. So, and I also see that Ibogaine leaves people with homework, and because people are approaching it with the addictive mindset, they're expecting a cure. And even though we can all sit here at our conferences and talk about it not being a cure, that is still the general belief amongst people, is that it's going to fix them. And so afterwards, when something comes up, anxiety, depression, the overwhelm of life, the low self-esteem, whatever it is, they are not prepared to deal with this. They don't see it as an opportunity. They see it as a burden, and it overshadows the benefits of the medicine completely. and they're obsessed about the one thing that's wrong, and they don't notice all of the things that are right. And also I noticed that, still with observations here, that a lot of times I think us as professionals have a hard time supporting people around the emotional homework that comes up. So I notice with providers, and I think we all just need to take a look at it, that when the patient's emotional stuff comes up, we want to push it back down. Their anger or aggression comes out, their anxiety starts coming up, whatever it is starts coming up, and I get calls from providers and counselors and lots of people like, we don't know what to do, and I notice they're giving benzodiazepines, or they're putting them in front of movies, or some of them even take them out for entertainment, but anything to keep that stuff from coming up. And so these are some of the observations I see, and because of this I see a great opportunity here. I see that we have an opportunity to provide better preparation before a person goes into this. So I'm not talking about an hour or two of preparation medically that you do on site, but preparation in the week or 2 weeks or sometimes even a month beforehand. We have been preparing people for Ibogaine for years, and we see a drastic difference in talking to people. And I know some of them are, most of them are on a lot of substances, and there's a lot of thick walls and it's hard to get through. But we see that there is wiggle room in their psychology. Their true self is in there. That's the self that's coming forth to change. And so I see an opportunity, or I've seen an opportunity, and this is what we do, is provide these preparation courses. And in addition to preparing them, which I guess I'll talk about that in a minute, but also providing skills training, coping skills training, and navigation skills training. So we teach people how to actually be in the medicine so that they can open up and receive, instead of just gripping to fear and resistance and waiting it out and shutting off their mind and then coming out and saying, I remembered nothing. And this happens a lot as well. I see that we could increase the support on site as well. Maybe that means having, like we have a team of coaches, I can tell you about that later. Sometimes we Skype in and offer support, but it probably just means getting more support or more training for people on site, which is what we do, and we can support on. Including families is really helpful to the whole process. Families don't understand Ibogaine, and they often cause a lot of problems when a person comes back, because they have undergone such a massive transformation and then they return home and they're kind of held back in that place that they were before they left, and it makes it very hard for them to move forward. So educating the families and including them, we have found to be tremendously beneficial. It's not easy to do, but we do that, and we can help you in your clinic. And then just having, an extended aftercare program. A week is not long enough. A month is not long enough. Addiction is something that can take people years to overcome, and I do think Ibogaine cuts that down by 90%. I think it's phenomenal. This is why I continue to do this work. But the integration is still a process of transformation whereby a person must take responsibility to continue to do their work. As far as the findings, I can just say that the preparation and the integration coaching that we've been doing, and the family coaching that we've been doing, and the group coaching, it works. And it's a great adjunct to the psychotherapy that everyone is providing. For a lot of patients, it's difficult to dive into psychotherapy because they're very vulnerable, and they've already been pathologized so many times. It's hard for them to have enough strength and confidence and courage and will. I mean, a lot of them just don't care. And I find that coaching is a really great adjunct to this whole process, because it does boost their self-confidence and their esteem and kind of drive their spirit, connect them with their passion. And it's a fun way to engage in their transformational work. So we have gone from the sobriety-based paradigm into the transformational paradigm, and kind of moving or evolving the conventional way that we're approaching addiction, and people love it. And they're coming to Ibogaine because they want something new, and we find that a lot of them are very resistant to psychotherapy because they have been let down by psychotherapists. Not every psychotherapist is able to help people through addiction because of their own conditioning around what addiction is and isn't. And also all the psychiatric medications they're constantly put on in the diagnosis, it's very difficult. So our findings is that the transformational work and engaging people around this through preparation and integration over a longer period of time is very effective with Ibogaine. So taking a look at preparation, the last time I spoke I went into more detail. I'll just highlight a couple of things. If you're interested, you can, I put a clipboard here, you can leave me your email if you want more information. The significance of preparation is that you're maximizing the benefits, you're reducing the risks, the disappointments, the letdowns, you're increasing the readiness and the ability to receive, and also you're helping a person understand their responsibility and their role in working with the medicine. So they're not showing up, like we were talking about today, we are working with people under the influence of addiction. The belief system of addiction is that the answer is outside of me. And so it's difficult to kind of turn that page of I have the answer within me. And so preparation is helpful in starting this conversation and introducing a person to their transformational work and then laying the foundation for integration. A lot of times we think integration starts afterward, but it doesn't. It starts before. You have to lay the groundwork before, because that addictive mindset, as soon as it comes out, that alter ego is already planning its escape route. It's already looking at what didn't work, what went wrong, or it's on the pink cloud and it's like, everything's fine, I don't need anything, this is perfect, I'll never use again, I feel great. But that wears off. And so we have to start the integration beforehand, even if it's just 1 week. Whatever time we can get, we can do a lot ahead of time. The areas of preparation, I really don't have time to go into them, but the areas that we look at, of course, is setting and helping clients to, we don't make recommendations per se, but we definitely like building relationships with the very ethical, legit Ibogaine or Iboga centers, and so we can help guide people. But being in the United States, we can't really, make recommendations, but we can have patients ask the right questions and do their due diligence to make sure that they end up in a center that's right for them. We go through the mental preparation, which is huge, helping them to develop that observer mindset, so they're not the victim of their mind, but they're starting to be able to see themselves, so that when they get in the experience and they take this, truth serum, basically, and they go up against their shadow, they've already been doing that for days. They've been learning that, and so they're ready to go deep when they get in, because they've been looking at some of those walls around them, preparing them for the discomfort and the expansion, because it can be very intense, and again, it can be very scary and traumatic for people when they go into the experience. But if they're preparing through different meditations and really just awareness in general, it can help them to stay alert and fit and present during the experience. We talked to them about the physical preparation. I think it's kind of obvious what that is. Spiritual preparation, just opening the spiritual dialogue. What is it that what is their spiritual beliefs? What do they think? We use the term true self because it's a very neutral term that doesn't seem to, trigger anybody. And so we talk about the relationship with the true self. It's very fitting with Iboga, and talking about the spiritual purpose, because there is such a grand opportunity within Ibogaine to go deeper than the material world. And for someone that's undergoing addiction, they are very attracted to the material world answers. And so with the spiritual prep, it can be very profound for them, because that's the addiction, is spiritual depletion. And so you can open that conversation so that when they get into the medicine, that it's very it's easier for them again to go deeper. We do preparation around home life, relationships, lifestyle. I'll have to kind of get into these things later, but it's important that and then integration setup, so I can lump all these together. It's important that they understand what integration is, where they're going to go afterward, who their support team is going to be. They need to tell their loved ones that they're doing it. So many of them don't tell anyone that they're going down there, and it's so dangerous, I think. And it's just not helpful for them. A lot of them are trying to hide the fact that they have an addiction problem. They go to do Ibogaine. They just want to, pretend it never happened, go back to work. And after hundreds of these conversations, I can see the red flags immediately with people. And I think we can really work together to help educate them that you can't just take a magic pill and get out of addiction. The whole point of addiction is transformation. And when a person really realizes that opportunity, it's going to be easier for them to understand the importance of setting up their integration. So anyway, we look at their home life, their relationships, their lifestyle, where they're going. We can talk about this more later. We look at the navigation training as well. This depends on how much time we have. Not everybody wants to know what happens in Ibogaine. There are the people that are just like, I just want to step into this. I don't want to know. But there are also the people that have been pushed into it by their family. Someone hears about it on a documentary or TV and goes and tells their, loved one that's addicted to heroin or something that they need to do Ibogaine. They show up at a clinic and they have no idea what it is. They think it's an herb. They think they don't even know what a psychedelic is or an entheogen, and they're about to take this medicine. And I just think it's not really fair or appropriate for someone to step into this without having informed consent. I think they need to know. And once they're already there, then they feel obligated to do it. So we do offer navigation training to the clients if we have time to do it. I forget to change the slides. So with navigation training, there's quite a bit we can do. The significance is to help them open up to the experience, to be able to lean into the experience, embrace it, accept it, own the experience as their experience, and to help them to put down their defenses and to identify where their work is. So when they're in the experience, they can connect with the work when it's present, and they don't see it as a disappointment, but actually they use the resistance or the fear or whatever it is that's coming up as a signal for their own work. And they're prepared to understand it in this way. So there's a lot of things, we use different tools and skills and strategies. Tools are basically internal and external stimuli that they can use. Those can be things like mantras, candles, crystals, essential oils, different imagery. We use skills. Skills are things that help them enhance their self-awareness and their ability to stay alert within the experience. And then we talk about different strategies as well, which is the applied teachings with an intention. So an example could be to, show reverence for the medicine, to sit upright. Well, I can't really do that with Iboga so much in certain cases, but to say yes to the experience, to just trust in the process. There's a lot of resistance in the experience because people have read about other people's experiences. They have a lot of expectations, no matter how much you talk about dropping expectations. And so so having some strategies when they go in there, maybe I'm a person that's always in the driver's seat and I want to have a strategy to just sit in the passenger seat and just let go and and just have the experience that I'm meant to have. Or maybe I'm a person that's always in the passenger seat and I need the opposite. Sometimes I need to get in the driver's seat. So whatever it is, there's a lot of different strategies. There's hundreds of them, but we break it up into tools, skills, and strategies, and we can teach those, or you guys can teach those to people beforehand so that when they go into the experience, they feel empowered in their experience. We also talk to them about, just maximizing the experience. These are all things that we already know, but just talking to them about surrendering. Breath is their main lifeline between this reality and their Iboga experience. And people consistently tell us when they come out that that these things help them go a lot deeper. And they will tell us that if we hadn't done training with you, I don't think we would have got, near as much as we got out of it, knowing what we knew going into it. I think it's very similar to going into like the jungle in general. Would you just show up and figure it out, or would you get some skills and some training and some endurance and prepare for it? So again, there are people that don't want the navigation training, it depends on how much time you have, so we just ask them, we get to know them, what are their intentions, what are their fears, it's very individual for each person. Something else that's helpful is to talk to them about meeting challenges. These can be a very challenging experience, facing their fears, facing truths, reliving traumas. The sensory overload in general is something I remember very vividly from my experience. Difficult emotions, the letdowns, the pain. Ibogaine can really highlight pain in your body that you didn't know you had, or places in your body that you're not healthy can just flare up. And if you talk to them about this beforehand, when that happens, instead of freaking out and obsessing about that the entire experience, that there's little back pain, helping them to just be slightly aware of it, to be conscious of it, but to breathe through it, not to get stuck on that one thing. And just the duration and intensity as well. So there's a lot of challenges with the experience. So just talking to them and using any of the tools and skills and challenges that you would teach them in their everyday life, really, but anything that you're teaching them around navigation or preparation can help with meeting challenges. And then also, I think this is really important too, is to talk to them about managing disappointments. It's unfortunate, all the people I see that come out that are disappointed. And again, Ibogaine did its work. And I can tell you that we have reframed so many people's experience because they come out disappointed, and in a short conversation, they just see how amazing their experience really was. Because again, the addictive mindset is going to find the one little thing that wasn't perfect, and then they'll just focus on that. And so talking to them ahead of time about disappointments and how to handle them. It starts with letting go of expectations and continuing to let go of expectations as soon as they identify them, and observing their tendency to expect in the first place, and to compare their experiences with other people, and also to want to boast about their experiences, because sometimes friends go in together and they all want to go home and talk about their experiences. And so just observing that, being aware of where do my expectations come from, because we can learn a lot about ourselves from our disappointments. Also with disappointments is looking at the fact that the medicine's going to keep on giving. It's not over just because the 12-hour, 24-hour, 36-hour period ended. It keeps on giving. And so you can talk to individuals beforehand about staying in their process and being open to the fact that the gifts are going to keep on giving. And if they can just stay in that process, stay present, observe whatever it is that comes up, that's the gift right there. But again, the addictive mindset, and I'm talking about all of us. I'm not just talking about, opiate addicts. I'm talking about all of us have that addictive thinking inside of our head. Even the people that are coming in for psycho-spiritual work as well, to, stay present with their work and to identify what is in this disappointment and to keep moving through it so they don't get stuck. Now, looking at integration. Integration is something we talk about a lot, which is why I wanted to deliver a little bit different information today. So I'll just touch on it briefly, and then I'm going to speak about the addictive mindset a little bit more, because I feel like this has become our specialty. And one of our biggest successes, I think, with clients is that we do discuss with them so much the addictive mindset, the addictive personality, the addictive lifestyle, the addictive culture, so that they become laser focused in their discernment and being able to identify the difference between my true self and my addictive self. Because the addictive self is, a person is at internal conflict against themselves, and so it is... it's hard to overcome addiction because they're working against themselves. So I want to speak about that, but first let's look at integration. The significance of integration is that it expands the window of opportunity. It brings the experience of Ibogaine to life, and helps people to create lasting results. It helps them to integrate the wisdom and the truths, to extend their transformational work, to stay in process. It helps them to honor the awakening that they're having, because you start to take that lid off and awaken, And what happens when you come out? People just want to go back to their comfort zone. It's like, okay, I had enough, I'm good. And they just want to put it back on and go home to their comforts. And so the integration period is helping them stay connected to their true self, helping them keep that body awareness that they've achieved through the Iboga experience alive, and to an accountability for all of this. Because again, they just want to come in for the experience and then go home and wrap it all up in a little bow tie and talk about the experience and what it was like. So the integration is keeping them in their experience, keeping them connected to it, and helping them to continue to receive the benefits that come from this. So what is integration? I think of integration as is making the true self whole again, recovering what was lost or disconnected, to reconnect with what's most important in life, with the spirit, with the true self, with the life purpose, and in the purpose of self-actualization, ultimately, self-realization. Now, areas of integration or process of integration, did I write that out? So this is the process of integration, the general process that we teach in our training, which is a 6-step process. The first process is about receiving. So receiving is that introspective phase right after the experience is coming to an end, where a person is kind of collecting all the information. I mean, this kind of starts within, this starts before the experience. And this is why it's so important to talk about integration before the experience, because there's so many ways that we receive information. We have so many different senses, many senses we're not even open to, much more than the 5 senses, that's for sure. And so there's a lot of perceptions and feedback and intuitions, reflections that are coming through this experience before, during, and after. So the first part of integration is receiving. It's very hard for people to receive, especially when you're really clouded in an addiction, because you have taught yourself with all these defenses to keep everything out. So the first process is receiving. Step 2 is the processing phase. This happens after the Ibogaine experience. You want to help your patients or clients create space to absorb the insights. So they've received everything, and now we need to process it. What do I make of this? I've had all these experiences. What does it mean to me? And what insights and wisdom can I draw from this? And then in step 3 is turning it into action, implementation. So helping people bring those discoveries and those insights into their life. What does that look like physically or mentally? What changes are they what changes are they going to make? What commitments? It might even look like helping them put together a new discipline to sustain those changes. Step 4 is releasing. Now, when I say these steps, they don't have to be linear. I just have to use the linear fashion to communicate them. But, you know, step 4 can happen anywhere in here. But step 4 is about releasing the baggage, what's not serving someone anymore, the limiting beliefs, the attachments mainly, the defenses, everything that is preventing them from being true to themselves. And then step 5 is practicing. Now I have a new discipline. I have a new mindset. I'm continuing to cultivate this. What is my daily practice? Is it a meditation practice? Is it a martial arts practice? Is it a musical, artistic practice? You know, it's very unique for each individual. And that leads us into step 6, which is what is their pathway of mastery? Ultimately, this is what the medicines are opening us up to, is our inner truth, and again, a pathway of self-realization. And so this is the integration process that we teach. It's kind of simple, but it's also very deep. Again, it doesn't have to be perfectly linear, but it's easy to communicate and it's easy to guide people through. Okay, let's move to the last section. It looks like I have just about 10 minutes here. And let's talk about the addictive personality. So working with addiction. This is a big part of the training that we do. What I see is that Ibogaine is helping to redefine addiction, and I definitely have to honor my work with the medicine and all the microdosing and all the testimonials that I've had over the years to refine my own understanding of addiction. But what I see is that it is debunking debunking many of the conventional beliefs about addiction. A lot of people that are coming to Ibogaine are people that have gone through the traditional system a number of times. Of course, I'm speaking mostly from the United States and Canada, but it hasn't worked for them, and there's a lot of stigma that's happening. And I think Ibogaine is really debunking a lot of our former understandings around addiction. Addiction in general is most commonly seen as a progressive and uncontrollable habit despite negative consequences, focusing mostly on the physical, observable behavior. As the conventional influences claim addiction to be medical and or legal, ascribing mostly to definitions like brain disease, mental illness, chemical imbalances, genetic factors, or even criminal delinquency, I think Ibogaine is showing us a much more complete picture. While addiction does manifest physically and medically and legally, to me, what I'm seeing from this experience is that it is less of a medical and legal problem, and it's more of a psychospiritual, social, cultural, environmental, lifestyle, and biophysiological problem. So we look at addiction in 4 quadrants, and what we see is that all definitions for addiction do play a role. So whether it's a moral failing or poor choices or peer pressure or social conditioning, or self-medicating behaviors due to trauma or pain or discomfort, toxicity, oppression, deficiencies, or just disconnection in general, we see that there is room for all of these definitions, but really no one definition is complete when we're looking at the phenomenon of addiction. Now, the reason I think Ibogaine works so well in helping people with addiction, and again, other kinds of suffering, because as I've been doing this for so long, I see that a lot of suffering is tied with addiction. There's a lot of similarities. Some people think this is the same thing in our community now, the more that we dissect it. But we see that Ibogaine is working so well with addiction and different states of suffering because it is targeting each of the quadrants. And so, we have the, biophysiological quadrant, of course. Ibogaine is providing that reset for the neural pathways. It's detoxing the cells. It's surpassing the withdrawal. It's reducing or even eliminating cravings. It's helping to balance the chemicals. From a psychospiritual perspective, it's providing a psychological review. It's helping with mental pruning, a reorganization of the mind and the mental files. It is assisting with emotional healing. It's helping to bring truth and clarity, again, connection to the true self and to one's life purpose. And something I think we need to be talking to them about a lot more, because I do think addiction is an invitation into the existential conversation, and I don't think you're going to get very far with clients if you don't discuss this with them. And Ibogaine does open them up to the spiritual journey. They may be resistant beforehand, but they're certainly not afterward. Looking at social cultural, Ibogaine is helping to dissect the relationship dynamics. This was a big part of my experience, is being able to look at my ties with all relationships to everything. The social conditioning, just the veils of society are being removed in general through the Iboga experience, which is greatly assisting in the ability to transcend the addiction presence in the mind and body. And then, of course, from a environmental lifestyle point of view as well, it's providing a life review. It's helping people take a look at what they need to change in their life to create the changes they want to change in themselves. So there are 6 things I'll cover to wrap up my last 6 minutes here. Working with addiction, you have to understand the addictive personality. It's no easy feat. We could, there's this, I think the addiction phenomena is the phenomenon that pulls us, into our suffering, but it's also the invitation to get on our path of self-realization. And so I think we're all dealing with these things, so it's a pretty comprehensive subject. But 6 things that I outlined to share with you are that when you're working with the addictive personality, they think it's just a physical thing and it's a behavior. It's not. And again, you don't get very far with them if we just treat it this way, because we're also treating addiction with the same mindset that started the problem, which is that it's a physical, material thing, and it's not. That's the last thing to manifest, and it's the first thing to go, but it's a much deeper process. And so the 6 things I've outlined is that with addiction, it's an illusion. It's a limiting belief system where a person believes that the problem is outside of themselves, therefore the solution is outside of themselves. They have an addiction story that they're carrying, and this story is simply false. It's not real. So when you're working with people around addiction, you have to address the falsity, the facade, the limiting beliefs, the addiction story. For everyone, their addiction story is a little bit different, but what is the addiction story that they're telling themselves? For instance, the story that suffering is bad. Is suffering bad? Our ancestors have always told us it's not necessarily bad. We learn and we grow and we strengthen through it. But for someone that's in an addiction, they can't stand to feel any kind of, if we've been there, no emotional pain, no physical pain. They want to use Ibogaine and feel nothing. And it's not possible. It's not possible to get sober and move into your sober reality without feeling that pain. So you have to look at the addiction story with them and help them come out of the ignorance, the falsity, and you do that through conscious conversations. So with coaching, this is what we do: conscious conversations, truth conversations, helping them to look inward and accept responsibility and look at this need for instant gratification. Number 2, disconnection. This is a major aspect of addiction. So helping a person to understand where they're disconnected. You can look at their disappointments, their distrust toward the world and toward others, and also where they are distracted within themselves. And it provides a lot of insight to where that disconnection is. And when you're working with them from a helper's perspective, you want to talk to them about the connection to the true self, positive connection to others, and helping them find a real sense of belongingness to a conscious community, a positive community, or helping them create that within their own community. Number 3 is the layers of burdens. With addicts, there's a lot of burdens, and we cannot expect people to just drop their safety blanket. When we're looking at heroin and opiates or alcohol, these are very extreme numbing agents. And what happens is that there's a pile of burdens underneath this drug or substance addiction or behavioral addiction, and they cannot put that down. They cannot give up their safety blanket until they start to lessen the load. So there's so many burdens that every single addict is carrying, and this is very easy for anyone to do. We do it as coaches or psychotherapists or even just helpers in the clinics, to just talk to them about what is on their mind, what is stressing them out, what is keeping them up at night. And if you can get to what is on their mind, you're going to keep them engaged. And if you can help them problem solve whatever it is, burdens come in so many forms. The deeper stuff, of course, is trauma, but a lot of it is just surface stress that they're just procrastinating, and it builds up. And so if you want to help an addict get sober, lessen their load under the addiction. Don't try to take the safety blanket first. You've got to help them lighten their load first. That's why we do preparation. That's my theory. And then help them find healthier coping strategies and to continue to release their attachments. You also have number 4, the inner conflict. Inner conflict with addiction, you have the true self against the alter ego constantly. So they're constantly battling themselves. So you're going to see ambivalence, a waffling character, a lot of opposition between them and others, a lot of shortcomings coming up. So it's important that you're talking to them about the transformation, empowering the true self, being able to differentiate their true voice from the alter ego, working with them around character development, and just integrating the true self. So anything to help them find that voice. And with Ibogaine, it's so perfect because that's what Ibogaine does when you're under the experience, is it shows you all the different voices in your head. And by the end of it, you are left with one voice, which is your true self. And it's so clear at the end of the experience. But as soon as it's over, that alter ego sneaks back in. and starts to confuse the person. They start to think, oh, maybe I do want to use. Maybe this isn't going to last. Maybe my withdrawals are coming back. And the panic starts. Number 5, the insatiable desire. This is, the spiritual depletion. Something has taken over them. With addiction, they will stop at nothing. There's never enough. Very self-absorbed. Can be very selfish and manipulative. So it's important to address the emotional hunger, the pain, and help them build emotional tolerance and observe these influences in their life, that hungry ghost that Gabor Mate talks about. You also have to address this if you want to help addicts. Again, Ibogaine is so perfect because they're in an experience that's showing them this and the excessiveness behind this. So you want to be talking to them about this experience and help them to build the tolerance, to be able to, and the contentment, to be able to endure little bits of suffering so that they can work through this. They can't avoid suffering. We cannot help them do that because that is addiction right there. We actually have to help them get better at suffering. That's how they work through it. Last thing I'll mention is the just uncontrollable habit and the material world conditioning. This shows up in so many different ways. When we're talking about addiction, there is a social gridlock of society's norms that people are trapped in. So it's not just them and their addiction. They're trapped in a whole society that is making it difficult for them to get out. Their lifestyle, addiction is a lifestyle. It's a way of coping. It's a way of functioning. And so they have to, address this framework and all of their connections in society to help them to reroute these things. What we do is we teach a recovery strategy, having a really solid recovery strategy in place that they design themselves. They have to be in control of it. That's what addiction is that the true self has to free itself. So that wraps up my talk today. Thank you so much for listening. There's a lot of information. I put out a clipboard if anybody wants more information. How many of you in here are counselors or in the position to be helping people with integration or preparation before and after the experience, or interested in doing it? So you guys might know a lot of this stuff, so thank you for listening. But if you are interested in connecting with us, I did put a clipboard here. If you want to leave your email, I don't send out newsletters. I'm not going to send out a bunch of stuff, but when we do have information about any trainings we do, or just come up and talk to me, would love to hear from you. Thank you so much.